Thank you so much for being with us today. Really appreciate it.
Thank you very much. And let me to start with thanks for His Excellency Dr. Nabil Fahmy for his invitation for me to share you our experience. And also I would like to thank Mohamed Salama. And I would like to thank all of you for your time. And of course, thank you, Dr. Hesham, for introducing me for your colleagues. And thank you for everything I had learned from you and my son also. This is the pandemic era and everything changing. And we need to be realistic in our decisions, and we need to change our thinking way to be able to manage and proceed. And as you see, we almost with 1 year in the pandemic, and the number of cases and the number of and the mortality also increasing. The first wave of pandemic was the maximum reported cases in some countries like European countries was maximum 5,000 daily, but now we are talking about more than 100 and 130,000 daily, and of course the mortality increasing. So maybe we need to change every thing in our life, and we need to live with new norms. So thank you, and anytime I'm ready to share you my experience.
Maybe I'll just start with a quick word again of appreciation for making the time to be with us today. I know how crazy your schedule is and how busy you are. You're taking a big part of the burden in managing this very complex situation that's very new. And that's why we really thank you at the AUC and the School of Global Affairs and Public Policy for making the time to be with us. So thank you, Dr. Hala. As we discussed, we have with us today more than 75 people joining us. And I think the main objectives that we set out for the discussion is really to learn three things. Of course, your experience in managing the pandemic over the last year, as you indicated, and how dynamic were you in changing also the way we manage the pandemic during different phases, because I'm sure the way we manage it in the early stages are different than the way we manage it during the peak time, and also the way now that we're preparing, let me say, for the second wave. Another dimension that we would love to hear your perspective on is the idea of solidarity and how integration, whether at the regional level or the local level or the international level with different kinds of organizations, you think have been useful and in managing the pandemic, and even maybe on the future about how we're going to deal with the pandemic in the future. The idea of integration and collaboration. And finally, I think it would be very important for us if you tell us how you took the lead in organizing how while we are protecting the healthcare side, we're also protecting the livelihood of people. So in the economic sectors, in the municipalities, and coordinating with other ministries like education, tourism, and so on. I know we have a lot on the agenda, but the topic is so rich and so intriguing for a lot of us. We have a lot of questions already coming in. And of course, I know Dr. Mohamed Salama also has a lot of questions on his side. So we will start by giving you, Your Excellency, the time first to walk us through the presentation around these topics. Then we will start with the discussion.
Thank you, Dr. Hesham. And let me, before starting my presentation, and please, if the time was exceed the expected time from your side, please let me to know. But before starting, let me to say something that I every day I'm talking with my colleagues that this pandemic is a sudden exam or the world entered in the last January in sudden exam. All the people, all the countries enter the same exam without preparatory phase, and all the questions from outside the curriculum. So you need to think, not to follow the regular thinking way, but you need to think and you need to create. And whatever decision you will take, you need to know that this decision will be a forever decision. You cannot talk about complete lockdown if you will not be able to work with this measure forever, because this is a virus. And even if they discovered the vaccine, we have a lot of vaccines for influenza, but all people every month, every year affected with influenza virus. So whatever decision, this is the big title for our management. Whatever decision we will take, this will be a forever decision. You need to work with this decision for a long time. We don't know when we will reopen our business and our life with the normal or the old norms. So let me to share you my my presentation. Okay.
Before the minister starts, could I? Yes, this is Nabil Fahmy. I'm sorry for being late, but I just got off a conference with China. But I wanted to personally welcome you, Minister, and thank you so much for coming to this event with us. It's really an important issue, and you're under tremendous pressure and a workload. So I won't take much of your time. I will continue to remain with you, and Dr. Dinana will manage the event, but please accept my apologies for being late and my really warm welcome that you're with us today. Thank you, Minister. Go ahead, please.
Thank you, Dr. Nabil, and hope to see you soon. And thank you for your invitation to be able to share all of our colleagues in AUC, our experience in the last year. This is a presentation. If all of people see the presentation in a good way, it's okay?
Yes, now it's good. Thank you.
As I mentioned, pandemic, the COVID-19 pandemic is an unexpected global crisis. The main aim is to set a national health targets for so all the stakeholders can focus on this problem in proper way. Of course, it is multi-sectorial, and the government will be responsible on the management, as we saw in different countries. The Prime Minister of Malaysia, Prime Minister of UK. It is a very high-level management issue. As I said, the decision should be based on different pillars, not only the infectious or the epidemic by itself, but also social and economic consequences based on our decision. These decisions should be based on our experience or country experience in different issues or different crises like the pandemic. As you know, maybe the European countries and the high-income countries did not exposed to this type of crisis, pandemic crisis, or this type of epidemiological problem in the last 100 years. So maybe the low and the middle income countries can manage more properly with this type of crisis. Our strategy focused on if you see the two curves, we have two at that time in January 2020. Every country can take the decision based on if the country can work on the peak of pandemic and can manage the peak of pandemic in very short time, or the country can flattening the curve of the pandemic, so the healthcare capacity will be able in different all the time to be able to absorb the increasing, but in flat to absorb this increasing, it should be a flattening curve. So a lot of European countries and some countries in Gulf area, maybe all the countries of Gulf area and America, we're working with the curve, the red curve. They taken all the shock at once. So the peak was in few weeks after the starting. But if you know, the peak of wave 1 in Egypt was in the last June. So we has taken 6 months or 5 months to be able to, from January to June, to be able to absorb the increasing. But even when our peak was in the June, the peak was very, in comparison to European countries, was very limited number of cases. The maximum was 1,900 cases per day in the peak of wave 1. And versus more than 5,000 to 6,000 daily in the Europeans. So this is our strategy, is to flattening the curve of pandemic. This is the first slide that I presented in the cabinet meeting in the last January. The second part of this slide is the transition scenarios. If this is the phases that all the countries faced in the pandemic, starting from a very little number of cases, then sporadic cases, then clusters of cases in different governorates, and then what we are working on now is the community transmission phase. All the countries all over the world facing now the community transmission. Decisions were based on 5 prerequisites: the infectious status, the community engagement, adequate public health capacity. Here I mean the surveillance capacity of surveillance, the capacity of quarantine in different airports and different point of entries in our country, adequate of sanitation, everything. The fourth pillar is adequate healthcare system capacity, not only in Ministry of Health, but also in different, in university hospitals, in private hospitals, not only hospitals, but also labs and different
increasing the numbers of courses that are faced.
So management implementation mechanism, decision at the right time, consistent with the infection status and socioeconomic profile, government leadership centrally under the patronage of His Excellency the President, and with heading of the Prime Minister for all the committees, multi-stakeholders coordination on national level, continuous monitoring and evaluation, and fund allocation at the national level. Here the fund is not only for the healthcare, but also to support the economy. So the country allocated more than 100 billion Egyptian pound to respond to this crisis. We used about 5 to 6 billion on the healthcare to respond to healthcare issues. Since the start of the pandemic, package of precautionary measures or restricted measures has been taken, which is in turn had the effect on flattening the infectious rate and giving the healthcare system opportunity to be able to respond. And this is what did not happen in a lot of countries, especially high-income countries. This is the curve of Egypt, and this is the most important decision and the time of each decision that we had been taken at that time, starting from March, when we decided to close the schools and universities. Then at the end of March, closing the airport and close the commercial shops. Then at the end of April, decision to extend the partial closure. We did not do a complete lockdown, by the way. Then decision to extend the partial lockdown, reduce the lockdown hours. The decision to activate the total lockdown and suspend the public transportation for a week. And we learned a lot of lessons from this week. If you remember, this is the week at the end of Ramadan and the feast days. It was complete lockdown for the public transportation. And the lockdown is starting from 5 p.m. After, at that time, I will not forget when I warned the cabinet or my colleagues in the cabinet that if we will take this decision, the number of cases will increase at least triple after 1 week of the complete lockdown for 1 week. Why? Because the infectivity will increase, because people will spend more time in their home and close the area, they will infect each other. And this is what happened after the Eid al-Fitr. When the number of cases increased twice to triple times, because 1 week of complete lockdown of public transportation. Then we decided in the mid of June to start the home isolation scenario, extend lockdown and open domestic flights at the 1st of July, implementation of the plan to cope with the corona at the end of July, open the mosques on Friday prayers in the 1st of August, and then a lot of activities. We reopen a lot of activities after that. This is some of very crucial decisions that we had taken, not only for healthcare but also for economy. But based on our experience, as I told you in the beginning of this presentation, we decided to work to flattening our curve with two issues. The main issue is mass testing versus target testing strategy, total lockdown versus partial lockdown. This is a comparison between Egypt and Japan. Egypt and Japan population number almost equal the number of population of Spain, Italy, UK, and France. The total population of Spain, Italy, UK, and France equally Egypt and Japan population. Egypt and Japan decided to do target testing. We will not do a PCR for everyone or who want to do PCR. No, we will do PCR for people who has signs or symptoms of infection. But we will not do PCR for anybody. No, this is only for the people, contact people with symptoms, contact people with symptoms. This is Egypt and Japan strategy. But in Spain, Italy, UK, and France, they decided to do mass testing. And the competition of mass testing there was amazing. And each country compared the other, how many tests per million you did. So they decide to do mass testing. Also, they decide to do a complete lockdown or total lockdown. We decided to do partial lockdown in some times and then relieving the lockdown. After 10 months of our experience, the total test per million in these 4 European countries was about 90. This is 88. The total test, 88 million tests in these countries, with positive cases more than 5 million, and death about 170,000 deaths. Egypt and Japan did only the total test per million, only 23.9 thousand test per million, with total positive case in 2 countries 216,000, and total deaths in 2 countries about 8,000. So the number of total cases in the 4 European countries reported with positive PCR more than 5 million. The number of total cases in Egypt and Japan reported with positive PCR about 200,000. The number of deaths in 4 countries about 170,000 deaths. The total number of deaths in Egypt and Japan, 8,000 deaths. This is our strategy, Egypt and Japan strategy versus Spain, Italy, UK, France strategy. Their strategies based on mass testing and total lockdown, and our strategy based on target testing and partial lockdown or no lockdown. This is the result of, this is again 4 countries, and Egypt and Japan. This is the number, total number of population, almost equal. Total cases, about 200,000 versus more than 200,000. The deaths about 8,000, and the deaths 170,000. This is the results of our strategy, and this is the result of European strategies. How people or how different countries respond to the pandemic, and how does it affect the infectious rate or infection rate? Where March and April, all the countries, including Egypt, have taken a lot of measures, partial lockdown, complete lockdown, a lot of measures. And then after that, in May and July, some countries, including Egypt, released the lockdown according to their decision, and some countries keep or after that, some countries open the economy, and at the end, in the last month, Egypt and different countries opened the economy totally. To respond to this crisis from the healthcare system, we decided to keep a lot of health services with maximum capacity to be able to absorb the increasing number of cases. When we declare that the pandemic, and there is a pandemic and there is increasing in the number of cases, all cases are isolated. This is in the February and March. All cases are isolated in the hospitals, and 9 isolation hospitals and 50 triage hospitals, 27 laboratory, and 440 ambulance are allocated to manage the crisis at that time in March, February and March. Then we discovered that not all the cases need to be hospitalized, because 85% of cases are simple or mild to moderate. So we decided to, the mild to moderate case isolated in the dorms and the hotels for treatment with complete medical care and the medical sites there. So we worked with businessmen and with Ministry of Higher Education for the dorms, and the Minister of Youth for the youth dorms. We used a lot of thousands of beds in these hotels, dorms, to be able to isolate the mild to moderate cases there with complete medical supervision. Then we decided at that time, no, we will isolate those people in their home. So we decided in June to start the home isolation method for mild to moderate cases. At that time also, by the end of May and the beginning of June, we increasing the number of hospitals from 9 isolation hospitals and 5 triage hospitals to more than 340 hospitals, and we expand the laboratories and the ambulance. After decreasing the number of reported cases daily, we start to downsize the number of beds, and now we are working with about 21 hospitals for isolation and for triage. So only 21 hospitals, isolation hospitals are working now, and we expand according to, and we respond to according to increasing in some governorates, and more than 85% of infected cases or reported cases isolated in their home with complete medical supervision from Ministry of Health. This is how to be resilient and how to be flexible to respond to your needs without collapsing your healthcare system. If we decided to isolate all the cases in the hospitals, then our hospital will be collapsed. That's why we decided to use dorms and hotels to be, instead of hospitals, to manage the mild to moderate cases. And this is very crucial step. Then the home isolation is the next crucial step to manage and to keep the facilities of healthcare in able to absorb any increasing in the critical cases only. This is the fleet of ambulance, the testing facilities, the hotels, the hospitals, and of course, as I mentioned before, Egypt as low middle income country, and a lot of low and middle income countries have a good strong surveillance base, because we used to manage the infectious diseases all the time. And this was the base that we depended on this base, strong surveillance activity. Then the disease, when the disease declaration in Wuhan for first case, we start to evacuate the Egyptians from Wuhan, and this was a very important experience for our staff. Then after the recovery or reopen, we started to decide, or we decided, the cabinet decree, the cabinet decided that everyone will enter Egypt should come with PCR negative before arrival. This is a dynamic map, surveillance and monitoring of the cases. You can use this map to know and to see in dynamic way, and this map dynamic for each every 10 minutes. It will be the map will report new cases, and you can see up to village, up to the patient with the ID number. Not only the patient, but also the contact. So you can know the clusters, the increasing the number of cases in each governorate, where we should focus on the awareness, and where we can focus on the PCR, every case, everything. As I mentioned again in the beginning of this presentation, the pandemic is not a healthcare issue, it is a government issue. So the governance and leadership is very important, and the governance also in the Ministry of Health is very important. The leadership, how to empower your people, how to trust them, how to direct them, how to unify all people on one target. But to do this, we refer to our very important experience when we decided to eliminate Egypt from virus C. All the governorates, all the Moderator people, all the healthcare directors everywhere worked on the same target at the same time to eliminate Egypt from virus C. We use the same command center, and we use the same people to manage the pandemic. So the Minister Assistant for Public Health Issues who eliminated Egypt from virus C is the same person who headed the command center to manage the pandemic. We trained our health work. We empowered them with, and we supported them with a lot of incentives. We kept the essential health services and a lot of presidential initiatives to be able to empower or to keep the health of people in proper way to be able to face this type of crisis or healthcare crisis. We worked on the supply chain and logistics. We have a very important scientific committee who issued a lot of versions for clinical protocol. This is the hierarchy from Command Center of Ministry of Health to the governorates level, and even to village level or each point of care level. We use the telemedicine, we use the medical convoys, we working on the vaccination, so we keep our healthcare system and the healthcare services in proper way for all people. We did not close our hospitals in the face of different healthcare problems like trauma, like cardiac diseases, oncology patients, vaccination for polio, for everything. We kept our healthcare services in a proper way because we did not exhaust our healthcare facilities. Also, we prepared 5 governorates to be ready to issue the universal health coverage program there. So the president in the next few days will announce the entrance of Ismailia and Luxor governorates in the universal health coverage or new insurance coverage. Response to changing needs of the health. As you see, COVID-19 revealed the importance of protected vulnerable population, specifically where no previous care to these factors. This, what I mean here, when we discovered that mortality or fatality increased with the people above 50 years old and who has more than 1 or 2 comorbidities, chronic disease, diabetes, hypertension. We discovered that if you know the نفقة الدولة, the treatment on the expense of state, the treatment of expense of state decreased April and March, and the fatality at that time increased, especially for people above 50 and with comorbidities. So we decided to launch a presidential initiative to treat people above 40 from the chronic disease. we screened more than 17 million individual, 17 million above 40 years old from chronic disease, and all of them received their treatment. So we strengthen their health to be able to face this type of virus. This is supply chain, and how can we everything available, treatment, supplies, equipment, oxygen, logistics, everything. This is a committee to reallocate the resources, and we did not, as you know, the Ministry of Health budget is limited in comparison to different high-income countries. However, we succeed to use this our budget and manipulate it with this budget, and was flexible to work with this budget to be able to respond to the new needs. This is a scientific committee. They issued a lot of documents, protocols, guidelines, everything, a lot of documents on our website from the scientific committee. They also published in Lancet, in New England Journal of Medicine, and they worked with a lot of research centers on solidarity trials, not only on vaccine, but also to discover the new protocol of management. So our scientific committee is very important committee, not only for Egypt, but also for the EMRO region. As you know, we are preparing ourselves for the second wave, and we working with different pillars: the human resource, the vaccines, hotline, laboratories, facilities, public health programs, medicines, everything. This is how we prepared ourselves for phase 2. I will send you this presentation, of course, but I don't want to spend more time in to explain all these details. The solidarity and how we supported the others. As you know, the pandemic has no borders, and no one is safe until everyone is safe. This is slogan is very important. This statement is very important, and if any country believe that the country can be protected without support the others, I think this is very crucial mistake. We collaborated before the pandemic and after pandemic with WHO, with GAVI, the Global Alliance for Vaccination and Immunization, with the private sector, and we trained all the private hospitals to respond to be able to respond to this crisis. We worked with the Arab countries and African countries. We expand our research capacity to respond to the research solidarity or solidarity trials. I was one of the volunteers who received the vaccine from Sinopharm as a volunteer to serve the humanity and to be able to discover new vaccines that can save all people. We worked also with Sinovac in China on manufacturing of vaccine. You know, I was honored to visit China at the 1st of March, when all the people refused to do this. I was the only political person who visited China at that time. Also, His Excellency the President ordered me to visit also Italy in last April during the peak of pandemic, and with a lot of support to China and Italy with supplies, medicines, and everything. And we received also a lot of support from these countries after that. We supported more than 30 countries in African countries under the pandemic fund. Egypt supported with $4 million with supplies, in-kind supplies, medicines for about 30 countries from African countries. This is our support to Iraq and Lebanon many times. The first one for Iraq from 1 month ago, the last one from 1 week ago. Lebanon, a lot of support to Lebanon among the last 3 months. How different ministers responded to the pandemic. This is very important because it's multi-sectorial. So we worked with Minister of Endowments, Minister of Civil Aviation, Minister of Tourism, Minister of Solidarity, Social Solidarity, Minister of Transport, and a lot of Minister of Education and Minister of Higher Education. And we issued our guidelines for each business type in the last May, and we trained all the people from different ministries to be able to respond to this type of pandemic. This is our work with WHO, and thank you for your time, and I can respond to any questions from your side. Thank you.
Thank you very much, Dr. Hala. It's very obvious from the number of questions I received that the topic is very interesting and we have a lot of people that are engaged. I received more than 12 questions that I'll be organizing, but I would like first to invite Dr. Mohamed Salama, our guest and our discussant today, to make some comments and questions before I go through the questions received from the audience. Just to quickly introduce Dr. Salama. Dr. Salama is an associate professor at the Institute of Global Health and Human Ecology at the American University in Cairo. He got his doctorate degree in Germany. He has so many awards, I can't pronounce half of them, but I will talk about one of his last achievements that he worked with a group, a colleague, to draft the first reference Egyptian genome. And he also established the Egyptian network of neurodegenerative disorders. So Dr. Mohamed has a lot of interest in the topic, and I'm glad he's here with us today. I will yield the floor to Dr. Mohamed to make his comments and questions to Dr. Hala, and then I will make the question, share the questions that we received from the audience after Dr. Mohamed makes his.
Thank you so much, Dr. Hala, for the informative lecture. I learned a lot of things now, new things. Actually, I don't have questions. I might have some reflections on Dr. Hala's presentation. Being in principle a researcher, I find that the new situation of COVID-19, although it is of course, a healthcare catastrophe worldwide, but it is a good opportunity actually to start reconsidering our understanding of several concepts in healthcare and start doing research to reconsider reshaping our understanding of health. One of the concepts I think it is important to start re-understanding or researching is the concept of health determinants. As physicians, usually, I'm one of them, but usually as physicians, we are always of health determinants.
The concept
health and care
determinants, yeah.
Yeah, so
okay.
Usually as physicians, we tend to focus on treatment or diagnosis. And actually, I'm one of them. Yeah, I used to focus on the treatment. However, now we learn that there are other determinants that can affect or shape the response to certain challenges, like the COVID-19 and other disease. So we have socio-economic determinants, we have physical and psychological determinants, we have environmental determinants. It is mandatory to understand the different determinants and also compare determinants among different countries. Yani, to be honest, many of my colleagues in Europe or America, they are amazed that in Egypt we have much better situations than Europe. Yeah, we have some limitations. We might have a difference in the testing strategy. However, still they find that our situation is much better, far better than what they are suffering or challenging now. So this is one of the points we have to tackle. Why it is different? Why the response is different among different countries? What are the different determinants that affect the final response to the disease? Is it only the healthcare providers, or is it only the infrastructure, or we have different things? So I guess it is mandatory and crucial to start collaboration, international collaboration. I know, of course, that the government is collaborating and the Ministry of Health is collaborating with different foundations and international parties, but I think it's also mandatory to expand this collaboration to involve different research organizations here in Egypt with other research group outside Egypt. So
can I comment, Mohammed, on your very important topic,
of course.
very important recommendation? The only difference, or from my opinion, this is why I mentioned many times for a lot of people. A lot of healthcare entities or Ministry of Healthcare in different countries, they considering their role as to treat people. So I used to say I am Ministry of Health, not Ministry of Diseases.
Yes, yes, exactly.
So I need to keep people in healthy life and in proper healthy situation. Rather than to treat who will be diseased. So if you put your target to provide people with treatment if they will be suffering from any disease, you will lose the battle.
Yeah.
So you need to keep their health firstly. This is what we did in the 100 million صحة. Do you imagine if we will not treat, we screened more than 70 millions in 7 months. 70 millions in 7 months. And we treat 2.7 millions from hepatitis C. Do you imagine if the pandemic came and affected these people, how many dead bodies will be on the streets?
Yes.
When my colleague reported that the fatality increasing with comorbidities and with people above 50, we decided at the last June to start presidential initiative to screen people of 40 plus from chronic diseases and provide them with treatment for free. This is very crucial way of thinking on the Ministry of Health role. Ministry of Health دايما كنت أقول لهم أنا مش جاية أعالج، أنا جاية أدير. My role to manage, not to work as clinician. The second issue in your very important recommendations is the role of Egypt to share the experience with different countries. IMRO elected me, the 22 countries, including Iran and IMRO, elected Ministry of Health in the last month to be the head of, for 1 year, to be the head of technical committee for the IMRO region to support different 22 countries with a lot of experience. They also elected Minister of Health of Egypt to be the head of Ministers of Health and Social Affairs for the African continent for 2 years. And also for the second time, they elected the Minister of Health of Egypt to be the head of a technical committee for the Arab League, Ministry of Health of Arab League. Why they did this? Because they like to share Egypt in their experience, and also they know that the president, His Excellency, want to support all the countries. This is the solidarity from Egypt, and based on this, we are working now with different countries, even Syria. We had sent from a few weeks ago a lot of support for renal dialysis and HIV treatment for people in Syria under umbrella of WHO. Thank you, Mohamed.
Thank you so much. This is adding to our information. And actually, I liked much your expression that you are a minister of health, not treatment. So the health is more broader than treating disease or managing disease. So that's excellent. The other concept I would like to highlight also is the multidisciplinarity now in medicine. So originally we have different specialties, but when we had this COVID-19 situation, first we appreciated it as a respiratory disease. Now we are aware that we have different systems affected. So for treatment or management or handling a problem like COVID-19, it is not only the problem for a chest specialist, but we have some neurological sequelae, we have blood sequelae, we have renal and hepatic sequelae. This is an important issue also, that we should have always this appreciation of the multidisciplinary team handling one problem, even if it appears initially to be targeting one system. There should always be a crosstalk between chest and lung, chest and brain, chest and heart, and so on. So this is another reflection.
Very important. It's very important.
Thank you so much. And finally, the new medical services. And as Dr. Hala mentioned, we are now adopting new norms for medical service or for health services. And instead of the face-to-face consultation, we have the concept of telemedicine. So it's very important to adopt this and start thinking of the challenges, because something like telemedicine is coming with a toll of legal and ethical points. So initially, we usually say to physicians that physicians shouldn't give consultation unless he is seeing the patient and performing examination. Now, sometimes we need to offer consultation and sometimes prescription to patient. We are always consulting or seeing.
So if it's local authorities, for example, even if it's a judge or a prosecutor.
Can I comment on your, Mohamed?
Yeah, sure.
You're totally right regarding the telemedicine. We are using now the telemedicine on very large scale, but not only for consultation, but also we are working on e-learning. We developed a e-platform with Knowledge Bank, and we adopted the Incision Academy materials, Elsevier, and a lot of Harvard Medical School materials. And now we are working with e-learning, and we are working with telemedicine in very, very, very amazing way. We spent a lot of years to develop this, but we failed. But after this crisis, in few weeks, all people convinced that we need to work in this way, and this is very important way of training and also consultation.
Thank you so much. Yeah, that's why I think there is always a positive face for big problems like the COVID-19. Yeah. I have many questions, but I guess all of our attendees need to start asking, so I will give the floor to our guests. Thank you so much, Dr. Hal.
Thank you very much. Thank you, Dr. Mohamed. And again, I keep receiving more questions, so I'll try to group them to really stay within the allocated time. And again, I thank you, Dr. Hala. Maybe so far I've seen questions around 4 different topics. The first is really about the vaccine. Everybody is interested about the vaccine. Actually, just while we're talking now, I got a breaking news that there was reports in the US that actually impacted the stock market, that there are new reports from Pfizer that they have better than expected results for the vaccine. So it seems the whole world is now interested in the vaccine.
Election results, and now that we have a good vaccine.
So we have news about the vaccine and good news about the stock market. So I think it's a double hit, which is great. So I think we would like to hear your thoughts about, there's a couple questions about how long do you think the vaccine will be available for the public? There's talks about that the vaccination, based on previous experiences, usually will have a limited time effect. It has to be a regular process. So I think that may be question number one. Can I ask the questions in series before, or you want to answer one question at a time?
Okay, I will talk about the vaccine. As you know, more than 300 trials, 300 companies into the clinical trials phases, phase 1, and a lot of about 20 to 30 companies enter to phase 2. Now we have 11 companies or 11 types of vaccines in phase 3. A lot of these vaccines, many vaccines received emergency approval. خلاص اقفلوا مش مهم أنا هتكلم بس. So what we are working now, we are working with Gavi and WHO. They established a COVAX facility where they receiving the requests from different countries, and they will be able to support the different countries with 2 billion vial of vaccine or dose of vaccine. To enter in COVAX, you should be low-income countries, and but Egypt is not a low-income country. So we negotiated with Gavi and WHO. They accept Egypt and 4 countries to receive from COVAX vaccine, COVAX facility. Under COVAX facility, any company can pay their vaccine with a very low price for the low-income countries under COVAX facility. We reserved 30 million dose of vaccine from maybe it will come from vaccine. We negotiated on the price. They were talking about $12 per person, 2 doses with $12 per person. But we negotiated with COVAX, and we will receive was $4 per person, the 2 doses. They decided, they put some conditions. You must vaccinate only the high-risk group, the workforce group, the people with old age, people with low immunity and cancer or chronic diseases, and the pregnant woman. And we accepted that.
Great. Great.
On the other side, we decided to collaborate with different companies. We are working with Sinopharm. Sinopharm, one of the most important companies in the vaccination among a lot of years ago. It is from China. Sinopharm developed 2 vaccines. I was the volunteer, one of volunteers who received the vaccine of Sinopharm in the clinical trial. So we're working with Sinopharm in the clinical trial. They received the emergency approval from different countries like China, Emirates, to provide people with a vaccine, not not under the clinical trial, but as vaccine, as approved vaccine. But we did not, we will not do this in our country. We will wait until approval from WHO.
Great.
We are working with Sinovac now. It's Chinese company and we prepared our production line in Vaxera to be able to produce Sinovac vaccine when they receive the approval. We are negotiating now with Sinovac because the cost of production will be very high. We are negotiating now and with the ambassador of China to decrease the cost of production. There is a vaccine, Sankino, it's a vaccine, Chinese vaccine. At the end of last June, China decided to vaccinate all the military people with this vaccine, and they vaccinated all the military people with CanSino vaccine. But this is not for commercial issues, this vaccine. We have also a vaccine from Russia, but we prefer to work with China, with Oxford, with Pfizer, and we prefer to work under the patronage of COVAX facility or WHO and GAPP. So the 11 vaccines in the phase 3, one of them approved CanSino for military people in China, 2 vaccines getting the approval, emergency approval in some countries like vaccines of Sinopharm and Sinovac, and still Oxford and Pfizer under phase 3, and they did not issue any emergency approval.
Great, thank you very much for this elaboration. So you're giving us hope that with all of this pipeline of vaccines and the hard work of testing it everywhere around the globe, as you showed us the map, we should be hopeful that something will be available soon for the public.
Yes, as you know, Dr. Hesham, this is the first time in Egypt when the government decided to do clinical trials, phase 3, on public, and we announced in the media, and the Minister of Health shared by herself in this type of clinical trials. This is very important, not only for this type of vaccines, but also for the clinical research in the future. We broken the barriers between the clinical trials and public people, because people دايما يقولوا احنا مش فيران تجارب. So the Minister of Health was one of the
That's inshallah khair for the humanity, as you said, for the humanity.
شفت اسبوع زي الفل بسبب الفاكسين ده. But you know, after 45 days of the first dose and after 2 weeks of the second dose, they taken a blood sample to measure the antibody titer. I have antibodies now, but the titer is very low. Italy twice, and entered every fever hospital and chest hospital and received the clinical trial vaccine, and the antibody is still very low.
You are the safest person in Egypt anyhow.
I have antibodies that means that I received the virus.
Okay.
By the way, there is 3 types of vaccines in the 11 vaccines. Killed vaccine or inactivated vaccine. All the Chinese vaccines are killed or inactivated, and this is very important in the manufacturing. Oxford are life attenuated, very risky in manufacturing. And I think Moderna in America is mRNA vaccine, messenger RNA vaccine. It is part of gene of COVID-19 virus injected in the cells with different ways, yani. But this is 3 types of vaccine: live attenuated, killed or inactivated, and mRNA vaccine.
Great. Maybe that talk about clinical trials and research can really move me to the next point, which I received many questions. I think it was also back to the point that Dr. Mohamed was raising, is that explaining the numbers, can it only be the difference in the numbers between us and Europe and Japan, and how we do the testing and how we report the numbers? This seems to be a critical issue for the public, because those that don't really know, usually they see these very high numbers in Europe, and we see totally different numbers. And people were asking so many questions actually around, can we explain this difference in numbers just because of the testing? Or should we include other things like the demographic profile of the country, weather conditions, the immunity system of the population in general? And I think this is a very interesting point that a lot of people have questions and misconceptions of.
Yes. بسبب ستر ربنا.
As usual, was very, very important to start with.
ربنا وبركة دعاء الوالدين. يقول لك أصل مصر مبروكة ومصر يعني، وهي الوزيرة راحت الصين وجابت معاها حاجات. As I mentioned before, this is a sudden exam for all the countries at the same time, and all the questions outside the curriculum. So you need to create a logic way of management. If you will screen all people all the time, then you will discover a lot of cases, asymptomatic cases. The psychological part is very important. If I told you, congratulations, Dr. Hesham, your PCR is positive, I have no symptoms, then you will think, no, I think my temperature is very high, I think this is very important. So 85% of people asymptomatic. Why you will go to them and discover them? Let them to live. If that's what happened in Italy when I visited Italy in the last April, His Excellency, the Minister of Foreign Affairs, told me, when we screened all people, the hospitals suffered from crowdedness of a lot of young and old people. And then we decided anyone above 60 years old, go home. We will not manage.
Interesting.
No, we did not do this. We selected the cases, and then the mild to moderate with no comorbidities isolated at home with treatment, and the critical cases enter the hospital and hospitalized. This is what we did.
Is there any plans to engage in research that try to explain also the differences, say, based on demographics, based on genetic issues?
The lockdown is very, 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 stupid idea.
Okay. Interesting.
Stupid idea.
So you believe that the lockdown can be?
You know that America, in the first 6 months of pandemic in America, from January to June, 65% of people, of infected people with COVID-19, did not leave their home more than 2 months, and nobody entered their home for more than 2 months, completely isolated. If you are a carrier and I close the door on you and your family. The probability to infect the others is very high. If one will be infected, then he can infect the others also. This is theory بقولها لهم اسمها نظرية الفشار.
Okay.
واحد وقفل عليهم هيطرقعوا كلهم. خليه يا خالد يجيبوا لي الجراف. I will see you a graph. The graph when we decided to move from 2 weeks ago. The category of people and the jobs of people who infected. And we discovered that 65% of people, of infected people, were unemployed or housewife or retired. 65 of people, of infected people in Egypt, unemployed or retired or housewife.
So you reduce your risk of infection by going out and working. And
the jobs who infected is the farmers, the drivers, and the workers in the projects, mega projects. So when you work in open air, the probability of transmission will be low. When you expose for a long time in closed area, then the probability of infection will increase. This is بالورقة والقلم.
Excellent. I have to congratulate you, by the way, Dr. Hala.
This slide. This is a very important slide.
I would love to see it, and I would like to congratulate you actually that we see that a lot of decisions here were driven by data. I was very impressed to see this interactive map that you showed that tracks how you guys are almost on a live case tracking the number of infections. And I got actually 2 questions people were asking: is this data accessible to the public or to researchers, or this data currently is only available for the ministry and decision makers?
We have a mega data. We have amazing data. You can work with us, anybody, any entity, any respectable entity can work with us. We have 2 committees, scientific committee and research committee. The research committee not only for clinical research, but also for public health, for economic, for health economics, for everything. So if I am inviting AUC to work with us in and join our scientific committee and our research committee to be witness on this era and to work with us to publish a lot of paper to share our experience to different countries. As you know, I issued a decree, ministerial decree from 2 weeks ago. All the hospitals, more than 600 hospitals in Ministry of Health, all the hospitals should establish clinical research department.
Great.
And we graduated more than 500 physicians and pharmacists from Harvard with 9-month program in clinical research this year. And the graduation ceremony will be in December when the people from Harvard will come to share us the celebration. We graduated 500 researchers with 9-month program from Harvard this year during the pandemic.
Great. I think this is great news for the scientific community.
Yeah, sorry for interruption, but this means that we can actually collaborate with the Ministry of Health to work on research.
Yes. احنا خدنا اللي احنا عايزينه دكتوره هاله النهارده.
Yes.
We published in Lancet and the New England Journal of Medicine, and we would love to work with AUC to launch with AUC in different magazines.
Excellent.
Excellent.
Thank you very much for inviting AUC, and for sure we'll take this seriously. and we'll find, of course, follow-up meetings to see how we can activate that.
Something also, please share us in the research committee who are working on the 100 million صحة, because 100 million صحة is a huge data. You have more than data of more than 10 million women from 18 to above 18 years above in cancer, breast, and a lot of women health issues. We have more than 25 million children, anemia, stunting, and obesity. We have the data of more than 101 million person in Egypt who screened with different types of screening in the public health with their ID number, with their demographic profile, with their employment status, with their education status. So you have a lot of work to do, and we issued in the last week a paper with the World Bank on the impact of chronic disease initiative, presidential initiative to treat people and to screen people from chronic disease, the impact, the economic impact. So for each $1 spent on the chronic diseases on this campaign, the gain $2.4 for each $1 spent on the chronic disease campaign. The reflection on the economy is $2.4, and the GDP increased with 0.4% only for the presidential initiative as impact, economic impact from presidential initiative to screen and treat chronic diseases only, not only hepatitis C. The reflection of hepatitis C is amazing, as you know. So the health economic reflection is very important. We need a lot of people to work, we need to share you all the data, to work with all the stuff, to be able to publish and to publish in AUC journals and business review, and to share a lot of people in who are educated in AUC with this type of strategies.
Thank you for the invitation, and we'll take you on it, Dr. Hala. And if you don't mind, بس عشان الوقت مزعجك, if you can provide us with the name of a contact person after the call, so we can initiate that and put it in action. Everybody's so excited about this. And the ideas for research is not only on the medical data or the population data, but we're excited to see it from the business perspective, from even communication and public and mass communication and public education perspective. I got a couple of comments here from Ramiz Al-Hayya. He's saying, you guys are doing an amazing job of success stories, but you need some more engagement from professional media and public communication entities to tell the stories to the public, not only for
هشام قول لرامز الناس هتبقى oriented بمرتضى issue rather than these type of topics.
لا ما مرتضى خلاص بقى he got his days.
الكلام ده ولا حد فاهم الكلام ده. الناس هم بيشتغلوا الحاجات دي بس طبعا مش هتكلم عشان توجيهات بس يعني زمايلي دلوقتي جابوا لي ورقه مهمه جدا ان انا اقولها لكم برضه عشان تعرفوا الايام السوداء اللي احنا داخلين عليها. in the last March and from March to 2 months, March and April, April and May, the world reported about 5 million cases. The last week, the world reported 5 million cases. So by the end of first year of pandemic, the curve increasing in very
rapidly.
Yeah. So that's why I mentioned in my presentation, and I told my colleagues in the cabinet, if we will not be able to work with our decisions forever, then we will not take this decision. What we need to do now, we need to work in to accommodate ourselves and our new strategies to be able to respond to this pandemic for a lot of years. Not only the problem will not be solved with vaccine. We have influenza vaccine, and all of us
still get it.
will be patient with influenza anyway.
And we're coming up to the end of this very exciting and interesting session, and I really want to thank Dr. Hala a lot and Dr. Mohamed. And maybe I have just three concluding remarks. And before I thank also all the attendees, number one, I really like the statement you made about making sure that whatever decisions we take are for the long run. I think that that's a very insightful statement because we really don't know when this will end or how will it end. So I think this is a very important statement.
Yes, very much. Can I, excuse me, can I answer to a very important call? Let me.
Sure. I'm still capturing the question, and I thank you all, those that participated with us today, and we'll just make the concluding remarks, and then we will wrap it up. Really enjoyed having you with us today, and I know I didn't get to all the questions. I tried to summarize and group them, but I think we might have captured the essence of what people have said in the chat. So I thank you very much for your active participation.
Thank you, Dr. Hesham. I guess we have to follow up on the opportunity to collaborate with the Ministry of Health.
I will make sure that, because well, to be honest with you, I think that was one of my main objectives of the session.
Yeah, please. We have a lot of projects that need to start. Yeah.
Now we've got what we want. Actually, you can hang up now. We don't have to wait for her. No, we'll wait for her to be back. But I think that's a good step forward to open that channel and really to build on it. And I will make sure when I get this contact information that we will make it available for different parts of the community at the AUC, for the contact person, so to see how they can engage from different parts.
Please.
Thank you.
Okay. What did you say?
As I said, I really admire this thought about when we're making decisions, it's decisions that will stick with us on the long term. I think this is a very important takeaway. I'm just trying to summarize the key messages I heard. The second thing I think was very important is that we have learned from previous experiences. You have learned from the virus C experience. You've learned from the presidential campaigns, and this learning is very evident in the success story that we have in our hand. And I think this is an important message to take away. The third thing is
message, Dr. Hesham, how to prepare your people to be able to face this type of virus.
Exactly.
And responding to the infected people.
Yeah.
This is an issue, and this is another issue. You have to prepare. If you are the Ministry of Health, you are the Ministry of Health to keep people healthy.
Yeah.
Not only to their diseases.
Exactly. And last but not least, I really also found it very interesting that you guys need to connect the dots when the case you gave about how you monitored the spending على نفقة الدولة and the relation to the chronic disease and the relation to the spike in the death cases. This idea of connecting the dots from the different data sets, I think, is also something that's very admirable. And I think you guys are really doing a great job. I thank you.
Dr. Hesham, that the people on the, if you know, برنامج قوائم الانتظار, the waiting list program, the presidential initiative to
the
waiting list or the waiting time, we decrease the waiting time, average waiting time from 400 days to 17 days in 2 months. and then we avoided any accumulation in the waiting time. But we discovered that people did not come to the facilities to who registered on this program did not come to receive or to make the intervention, surgical intervention in the last May and June. Then we decided to refresh this program, to invite them personally one by one, come to do this procedure, catheter, heart, cardiac catheter, open heart, liver transplantation. So we finished all the waiting people who were reported in the waiting list to prepare them to be able to face this type of pandemic.
Excellent.
This is very important.
Just have one last comment from Shireen, who wants to talk about Cairo Festival City Mall, which I think is her perspective is we've been telling people to wear the masks, but we see that compliance has not been in its best shape. Is there any plans in the coming period with the threat of the second wave to really find ways without طبعا having askari next to each citizen to get people to take this issue about wearing masks more seriously?
This is what the cabinet decided in the last cabinet meeting in the last week, when we decided to close any store or any business activity facility 3 days if they will not work with different measures, restrictive measures. And I don't like to close the business, but we need to send them some serious messages. So we decided that we will close any store 3 days, or any cafe, any shop, any business activity 3 days. But you cannot put a soldier on or officer on each to catch each person. If I did a presentation, press conference to send a message. Your income and your job is linked with the pandemic control. A lot of people lost their jobs in high-income countries, and this is irreversible. If you will lose your job now, then you will not be hired anymore in the last 10 years, because the economic consequences and from this pandemic is very, very, very hard. So I linked the loss of job with the following the restriction measures. This is very important. You need, as a business school or school of business, or people who are working in on the economy by different ways, to send this message for the business sector. If people will have jobs, then no more jobs in the future. It's irreversible.
Excellent. I thank you very much, Dr. Hala, and once again, taking the time to be with us today, and we will keep on your promise to work with us in future research activities. I really, really thank you. I'm looking forward to stay in touch, and thank everybody for joining us today. And we will make sure that also we share with you the presentation we saw today from the minister, and as we have more information coming, we'll make sure that the AUC community at large will benefit from this. So thank you very much, Dr.
Start to work with us on the research arm, not only for this pandemic, but also for the presidential initiative in the public health sector, because the reflection on the economy is very, very, very important, and a lot of lessons can learn it from this type of management. Thank you, Dr. Hesham, and thank you, Mohamed. Thank you, His Excellency Dr. Nabil Fahmy, and all our colleagues from AUC. And I will not forget for you the C grade, Dr. Hesham. Never.
I'm telling you, انا هبطل تدريس بسببك يا We all make mistakes.
Thank you very much. Thank you.
Thank you.
Thank you.
Bye.
Bye.
Thank you.